So you already know that America has a broken multi-billion-dollar organ transplant industry, and if you don't, I got a link in the description on our deep dive into that. But what we got to talk about today is what could be the biggest threat to it. And what we got to talk about here is this Washington Post report that federal authorities are conducting a big, sweeping investigation into potential fraud committed by the nonprofit organizations that collect transplant organs. And this, according to 6 people familiar with the probe. Because as we've talked about on the show before, there are widespread issues with the U.S. transplant system. And specifically, at the center of all this, you have the nonprofit that has had an ironclad monopoly over the transplant system for nearly 4 decades. The United Network for Organ Sharing, aka UNOS. And not only does UNOS single-handedly operate the whole U.S. organ transplant system, it is the only entity that has ever run the system. And boy, oh fucking boy, does that arrangement have a truckload of problems. Right? According to government statistics, more than 103,000 people are currently on the organ transplant wait list, and 17 people die every day while waiting. And notably, that as UNOS has long been criticized for the number of organs they've discarded, damaged in transport, or simply just didn't collect at all. And then back in 2022, the Senate Finance Committee published an insanely damning report on the findings of their own 2+ year-long investigation, which again, we have touched on. But at the very top level here is that this report revealed a winding network of failures that have cost lives, and specifically 70 lives from 2008 to 2015, with those people dying due to mistakes in screening organs, while another 249 developed diseases because of the same errors. And we're talking about real basic shit, like failing to complete mandatory tests for blood types and disease. Also, under UNOS, there have been numerous breakdowns with the delivery of organs, like some being damaged in transit, abandoned entirely at airports, or just being left and never picked up. And with that, you have experts and lawmakers saying these breakdowns can be traced back to the technology that UNOS uses, with a confidential 2021 White House report obtained by the Post finding that the whole system needs to be overhauled, citing complete shutdowns, absolutely prehistoric software, and that's among many other issues and errors. But this is UNOS's rejected calls for reform. And this is the federal agency that oversees UNOS has very little power to actually regulate them and doesn't have the same technical expertise. So UNOS is basically able to get around new updates to technology that the feds require by just complaining about change and using a lot of confusing technical jargon instead of actually taking steps to fix anything. But this also, as one of the biggest complaints about UNOS, is that they're just simply a shitty boss. Because while UNOS is the big daddy that controls the whole network, it does this by overseeing smaller regional nonprofits that actually handle the collection and transportation of organs, with those nonprofits called organ procurement organizations, or OPOs, and there are 57 of them in total, with each holding its own total monopoly over the territory it operates in. And critics have long accused UNOS of not doing enough to manage complaints about these OPOs when they underperform. In fact, in the 2022 report, the Senate Finance Committee said that UNOS's lax oversight of the regional nonprofits, that was partly to blame for the many failures the report identified, specifically finding that 1 in every 3 OPO had failed to meet government standards for collecting organs in their monopolized territory. And this is UNOS basically doesn't do a damn thing to hold the OPOs accountable. And that's really important for what we're talking about today, because it's these procurement organizations that are at the center of this reported investigation. Now, at the moment, the exact scope of the probe, that is unclear, with sources telling the Post that it involves U.S. attorneys from numerous parts of the country in at least 5 different states, as well as investigators from the Department of Health and Human Services and the Office of the Inspector General of the Department of Veterans Affairs. And while the inquiry has been going on for several months, it appears to be intensifying, with the chief executive of the Association of Organ Procurement Organizations sending a letter to his membership that said that the VA Inspector General had dispatched investigators to the offices and homes of 10 OPO chief executives as part of an inquiry. And as far as what is being investigated here, sources say the probe is looking to determine whether these OPOs knowingly defrauded the government, and specifically whether any OPOs violated the Federal False Claims Act by intentionally billing the federal government for unallowable costs. With sources also saying the investigators are looking into whether there were any kickbacks between organizations and if 6 OPOs have fraudulently billed the VA and Medicare. Right? And the VA's involvement here is actually very, very notable, because it's not usually grouped in with the criticisms of the organ transplant system, though it still has plenty of its own problems. With a 2021 report in the American Journal of Transplantation finding that between 2010 and 2019, OPOs procured organs from just 33 deceased donors at VA hospitals, even though 5,281 were eligible for donation. And this also, as a person familiar with the inquiry, said that investigators are looking into whether OPOs are just using VA donors to collect body tissues that can make them more money, but not harvesting desperately needed organs. Because in addition to procuring organs, some OPOs also collect tissues like skin, bone, heart valves, and other body parts that are used for surgical operations and other medical treatments, with those being gathered both from people who also donate organs and from people who don't. And not only are those body tissues way easier to collect than organs, which obviously require much more expertise, but the market for them is also super lucrative. And unlike donor-like organs, information on tissue transaction doesn't have to be made available to the public. And while we only know so many details right now, this investigation is absolutely massive, right? Because it could result in criminal charges or civil lawsuits, with the Post saying this probe could be the gravest threat yet to the status quo in the troubled multi-billion-dollar organ transplant industry. And that's incredibly significant because this isn't the first time that the federal government has tried to crack down on UNOS and its network of problematic organ procurement groups. Right back in 2012, 2 officials in the Alabama OPO were convicted of healthcare fraud and other charges after taking kickbacks from a funeral home. And just last year, the Senate Finance Committee sent letters to executives of 8 different OPOs in what they described as an effort, quote, to crack down on serious potential financial conflicts of interest and abuse of taxpayer money. And there, we saw the senators specifically ask the executives about instances in which they potentially abuse their positions for monetary gain, with them going on to allege that OPOs and their executives have engaged in a complex web of financial relationships with tissue processors, researchers, testing laboratories, and logistics providers, which have the potential for creating conflicts of interest. And saying that the panel has heard testimony and received credible allegations that senior members of UNOS's patient protection and policymaking committees may harbor undisclosed for-profit interests and may be leveraging their UNOS leadership positions to self-enrich at the expense of patient care. And going on to say, these alleged conflicting financial and business relationships pose serious risks to those in need of a life-saving organ transplant. Right? And beyond that, Congress has also taken tangible actions to crack down on UNOS's monopoly, with it actually passing a law back in July authorizing overhauls to the system. But it's also unclear how much that'll actually achieve, because while it could take some power away from UNOS, the nonprofit will ultimately still be involved there. And UNOS actually didn't oppose the legislation, which is a pretty good sign that it probably doesn't go far enough. And all this as it's not just the federal government that's been taking aim at OPOs for alleged corruption. They're also going after each other, with one OPO filing a lawsuit back in December accusing a neighboring group of trying to steal one of its big nonprofit healthcare networks by offering $3 million to start a new transplant program in violation of anti-kickback laws. And so at the very least, that feels like a glimpse, but I mean, this is clearly an industry and system that is begging to be fixed. But with years and years of documented failure having not done that, all we can do right now is hope that this investigation is the straw that breaks the camel's back and that it brings about changes that are desperately needed.